Okay, so hi everyone, and today I'm going to make like a series of videos regarding the PCOS or PCODs, which is a very common disorder in every 8 out of 10 female out there. So we will start with the topic for cysts today. Alright, so let us go through cysts. Where are they found? What are they? So, for suppose this is your ovary, okay? This is your ovary. Now, the cyst can be found on the surface of the ovary, or they can be inside your ovary. Now, coming here, I have 12 questions, 12 commonly asked questions by people regarding the cysts. Okay, so going with the first question, what are cysts in ovaries? Now, usually the cyst is solid or a fluid filled sac or pocket within or on surface of ovary. Now usually they disappear within a few months but can cause complications if they don't. Now moving on to our second question, symptoms that you have cyst in your ovaries. What are the symptoms? Let us know them. Now, most of the cysts don't cause any symptoms. Now, in some cases, you see menstrual irregularity. Okay, in some cases, you see menstrual irregularity, you feel pain during intercourse, then you could have irregular bowel movements also. Now moving on to the third question, how to cure ovarian cyst? Is it possible? I would say yes. Now there are three aspects to it. One question, three aspects. First one is that medication which has hormones, medication which has hormones such as birth control pills, we call it oral contraceptives, right? So birth control pills to prevent ovulation and prevent future cysts from forming. Second aspect is watchful waiting. You have to wait. In many cases you can wait and be re-examined to see if the cyst goes away within a few months. As I said earlier, some of them usually disappear within a few months. If don't, then it can be a little bit tacky. And the third is you can remove them by surgery if it's very serious, and if the cysts are very big, they usually operate it, give a slit so that all the fluid comes out, and then eventually it dries out on its own and gets healed. Okay, now moving on to our question number 4. How to get rid of OC naturally? Your OC means ovarian cyst. Okay, how to get rid of OC naturally or reduce it naturally? Now, dose dependent vitamin C supplementation significantly reduces the volume and weight of the cysts in the endometrium. Okay, so what do you need? Dose dependent vitamin C. Dose dependent vitamin C. Okay, which leads us to our next question. Food to shrink cysts. Are there any foods which shrinks the cysts? Answer to it again is yes. You need high fiber foods, including broccoli, greens, almonds, berries, and squash. Another is anti-inflammatory foods that reduces inflammation, and spices including tomatoes, turmeric, kale, olive oil, almonds. You need lean proteins. What kind of protein? Lean proteins. You need lean proteins like fish, tofu, and chicken. Now, moving on to my next question, which is main cause of OC, main cause of ovarian cyst. Hormonal imbalance, pregnancy, endometriosis, and pelvic infections. Now, these are the main causes for an ovarian cyst. Next question is number 7. Can a cyst stop your period? Answer to it is ovarian cysts can also lead to problem with the menstrual cycle, such as you can have like heavy periods on days, or you have a really like irregular periods, or sometimes you only get spotting, and sometimes there is abnormal vaginal bleeding in between your periods. So menstrual problems occur if the cyst produce sex hormones that cause the lining of your womb to grow more. In cases the lining of your womb grows more than it has to. Question number 8. How quickly do ovarian cysts grow? What's the growth rate? Moving on to that one. So often they grow slowly, and the progressing rate is about 1.8 mm per year. How much? 1.8 mm per year. But there is exception to everything. Dermoid cyst. Which ones? I would say dermoid cysts do have potential to become large. Now, case studies have reported that some dermoid cysts can grow more rapidly, between 8 and 25 mm per year. That is like 1 inch per year. Which ones are they? Dermoid cysts. Now, next question, number 9. Drink to help OC, ovarian cyst. Is there any drink that can help you soothe the ovarian cysts? The answer to it again, yes. What is it? Studies have shown that chamomile tea plus honey. You can have this drink about 3 times a day, or even once. That's completely fine. Another question that I have not mentioned here, but I would like to tell you, is that what helps to prevent further development of the ovarian cysts. So you don't need to like do something for a while and then you feel like the cysts are gone. No, what you need a lifestyle change. You need to change your whole lifestyle, which is messy. You have to maintain a healthy weight. You have to rule out the fertility medication. You have to go for like regular gynecologist appointments. If you do smoking or if you drink alcohol or anything, you have to quit on that. Next question, which I've mentioned here, is what causes the ovarian cysts to grow bigger? Okay, now this one is an important one. You need to understand this thing really, well, and fit it into your mind. Now, when a follicle releases an egg, okay, so follicle releases an egg, this produces progesterone, estrogen. What are these both? Our female hormones. Okay, so when follicle releases egg, it begins producing estrogen and progesterone for conception. Now this follicle is now called corpus luteum. Pehle we called it a follicle, but now when it releases the egg which starts producing the progesterone and estrogen, now the follicle is known as corpus luteum. Now it's known as corpus luteum. Now sometimes the fluid accumulates inside the follicle. अब उस follicle के अंदर sometimes there is a fluid accumulation to grow into cyst. That fluid grows into cysts. So basically, what are cysts? So you can tell that the egg which is not fully developed and there is a fluid accumulation inside it. Wow. Okay, now next question. Do ovarian cysts affect your mood? Yes, you get mood swings. Now, women with PCO also have a higher risk of depression, anxiety, and extreme or rapid changes in mood. And the one last question, can you gain weight with ovarian cyst? The answer to it, yes, definitely. So this was all about the first thing that you should know about the PCOS or PCODs, which was cysts. Now we will make another video about letting you know what are PCOS or PCODs, how can they be cured, what are the medications that gynecologist might give you, etc., etc.